My name is Disa and I'm going to be talking to you about veterinary medicine. So I currently work as a surgical veterinary assistant in a specialty and emergency clinic. This webinar series is going to be specifically about surgery and veterinary medicine. In the surgery department, you will find surgeons, anesthesiologists, veterinary technicians, veterinary assistants, and sterilization technicians. Surgeons are of course responsible for the surgery, for the procedures. They diagnose the patient, they communicate with clients and other staff, and they come up with a treatment plan. Veterinary technicians are primarily responsible for the anesthesia side of the procedures as well as sedation of patients. They work very closely with the surgeons and the anesthesiologists to come up with what is called a drug protocol in order to safely and successfully treat the patient during the procedure. As a surgical assistant, you kind of have two primary roles. As a circulating nurse, you set up the OR, you set up the monitoring equipment. When it is time for the patient to roll in, prior to, you are opening the table sterilely and putting the instruments that are needed on the table. You are turning on the monitoring equipment and making sure everything in the room is perfect so that the patient can just roll on in. During surgery, you are there in case you need to open something, get another instrument, or in the event of an emergency and they need extra hands. So as a scrub assistant, you have a little bit more responsibility. You have a case or two or three for the day, so you are primarily responsible for that patient and the kind of instruments that you need for that surgery. Sterilization technicians, they are responsible for cleaning the instruments after procedures, repackaging and sterilizing the instruments. What will happen is our patient will come in, we will insert an IV catheter, we will then go to the X-ray rooms and we will take radiographs. Usually we do orthopedic rads, or we might do chest rads or abdominal rads. Once we are all clear, we will roll into what we call prep area, and this is where we intubate our patients and where I, as a veterinary assistant, will prep the patient for surgery. Our assistant will then start turning on the monitoring equipment, turning on all the OR lights that we need, any of the machines, and then they will open up my table sterilely. Once we're in the OR, it is the scrub assistant's job to set everything up. I'll scrub into surgery and we will drape the patient and then set up all the equipment so the surgeon can just come in, do our checklist, and get on with the surgery. After surgery, after we've closed, we will potentially perform follow-up radiographs just to make sure everything's in place, and then I will stay with the technician until the patient is extubated, and then we put them back in their home. That is it for my first video. Stay tuned for more.